Thank you so much for being with me today. I am over the moon happy for those of you that have been able to attend. There were some Zoom mess ups, so sorry about that. If you weren't able to get on the call and you're watching this later, it is not because I don't love you. It just happens to be one of those days today that have been a little more challenging than I wanted it to be. We're going to go over a few things today that I think are really important. I think for myself, because I was challenged with infertility issues and it took a while for my husband and I to conceive, I have a more of a special place in my heart for those that are struggling. And I think as time goes on, it is more and more difficult because we have more and more challenges. We have emotional stressors, we have physical challenges. I looked up a statistic to kind of set the pace for our webinar, Hope and Healing for Your Fertility Journey, which I think is a beautiful way to look at it because it's hope that we want to give. It's not just pointing out negatives. Um, it was a very interesting statistic that I found where it said 19% of couples are unable to conceive after a year of unprotected sex. That's a long time. Oh, yay, Sonia was able to get on the call. Hi, I'm gonna hold on one sec. I'm gonna take your video off. Oops. Oh, come on. Stop video. Okay, so I'm just going to stop your video. That way it's a cleaner recording. But 19% of couples are unable to conceive after a year of unprotected sex. That was definitely not my mom's situation. She had two surprises with my brother and I. 1 in 6 couples are affected with challenges for fertility, and that to me breaks my heart. Carmel went through a lot of this herself. We're not going to be diagnosing, we're not going to be prescribing anything like that. We are doctors. And I don't know if you know this, but the word doctor means teacher. We are teaching you. This is for education and possibly entertainment. You might find it amusing, but it's important and near to dear in my heart. So I'm going to introduce Dr. Carmel. She is my friend, the patience of a saint. She is compassionate, a dedicated practitioner, and she really challenges herself ongoing to learn more and more about fertility, health for babies, health for moms, health for dads. It's not just mom, get two to tango. So we got to deal with both mom and dad. And she really wants to uncover the solutions to the problems that people are facing with fertility. She brings a wealth of knowledge. She's a doctor of chiropractic, a diplomat in clinical chiropractic pediatrics, which I absolutely love. Those little guys need chiropractic work just as much, sometimes even more because of that trauma of birth. She has done extensive work in environmental health. She's certified functional medicine and a grow baby genetics empowerment. And she has her own perspective on fertility and how to deal with it. I love you, Carmel. I'm so glad that you can be with us. And I wanted you to share a little bit about your fertility journey because I think that's something that's important for people to realize.
Absolutely. You know, my journey with fertility is both professional and personal. It started out very professionally after a number of years, maybe like 10 years of working with kids and with pregnant moms and helping the mom prepare for a safe and easier birth. And I came to the conclusion that, man, we really got to get women um, in better shape before getting pregnant, because once you get pregnant, as you know, there's like so much you can't do. That's, just like a stop, don't do anything new. And so I thought, wow, somebody should really not just prepare women for birth, but what about preparing women for getting pregnant in the first place, right? And I told this to my colleague, and she's like, yeah, why don't you do that? And I was like, yeah, that's a good idea. And then I filed it away somewhere until it came to the point where I was about 41 when I finally found my true love. And we got married and we got engaged within 6 weeks. We got married 6 months later. And I mean, it was fast and furious. I was actually at that time healthier at age 41 than I was when I was 21. I'd done a lot of work on myself, and in many, many ways, metabolically and hormonal, everything. I was just much healthier at that time. So I thought, I'm not going to have any issues. So then a year passed, and I was like, okay, I am more than 35 years old. And they say after 6 months of unprotected sex, if you're not getting pregnant, then okay, this might be the time to reach out for help. So we started investigating, and we ended up doing our first round in 2000. So 2 years later, so when I was 43, we did our first round of IUI, which is intrauterine insemination. And first time we got pregnant, it was like, yay, see, I knew that wasn't going to be too hard. Until about 12 weeks later, and I had a miscarriage. And they told me what they tell most women, which is, oh, it's just chromosomal abnormalities and it happens. And I was like, I don't know about this whole chromosomal abnormality. Like, why? Like what's up with this? And so
And
my
that's one of
journey
the things with
continued.
miscarriages that is so important, is that why is important.
Really important.
Doctors
Yeah, and
just
we'll get
push it
into
off to
that.
the
Sure.
side, and it's like, no, that's not. And it's like, I had a miscarriage at, oh, where was I? I was 4.5 months along. I had a
Oh,
miscarriage.
wow.
Yeah, and after that 18 weeks, they're like, you're good to go. You can tell people. And I was 42 at the time, and when I miscarried, they're like, well, it just happens.
Yeah.
And
Yeah.
I'm like, what? What happens? What did I do? What is a way for me to not have this happen again? So I appreciate your like, I want to know. I want to know what's going on.
Yeah. Yeah. And we are so blessed to live in this time that we do. There's such incredible research available that is pointing to specific factors that are related to miscarriages and recurrent pregnancy loss. So to tell somebody, oh, it just happens, is kind of a cop out. It's it's like, no, we need to dig. That's when you want to dig a little deeper and figure out what's that barrier that's preventing you. Now you've gotten pregnant, maybe you've gotten past some barriers to get pregnant. Okay, well, now why aren't you staying pregnant? What's the barrier to you staying pregnant till that baby's full term, and all that good stuff. um in any case, so I did another 4 IUI cycles, and then they're like, yeah, we really think you should do we really think you should go to IVF. And so, my husband and I are like, well, whatever, we want to have a baby, and we didn't know anything else at the time. And so we did that. We did 2 separate egg retrieval, 3 rounds of IVF. We actually moved overseas because it was cheaper overseas to do that. It's the cost of doing IVF in this country is astronomical. People think they just need 1 round of IVF to get pregnant, and the average is 3 cycles to
Oh,
get
wow.
pregnant. So we did 3. We had lots of follicles, we had lots of healthy embryos, and none of them would stick around.
Mm.
So then they said to me, you know what? You're old, which is like the worst thing you could say to a woman anyway. Okay, I was like, okay, maybe my eggs are old, but me, I'm not old. What are you talking about?
But I don't
And
even, but your eggs aren't even old, because they're not like, you're not born with all of these eggs. You have the opportunity to create the eggs, but the eggs aren't old either.
they're all there when we're born. However, you can improve their quality.
Yeah.
The follicles we're creating each month. So, right? So we do have an opportunity to impact the health of
And
our
the
baby.
healthy genetics of the baby too. It's not just you're destined because you're old. That just
No, 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 no.
yeah.
Yeah, what we know today is that what's more important than the age of the mom is the health and the quality of her eggs.
Mhm.
And that is a factor we can influence. And I remember when I was going through all this, I would ask, isn't there anything I can do? And um, no, not really. They said, well, try not to eat so many carbs because high carb diets will decrease the quality of the eggs. And I was like, I'm already, eating pretty low carb. And they're like, okay, well, you're good. Just hang in there, and so then they're like, okay, but no, you really need some young, fresh eggs. That will improve your chances, correct? Because as you get older, each year it's like your chances are going down and down. So we did. We got some fresh, young, 27-year-old eggs from a lady
The
overseas. And
market.
what?
From the market.
Yeah, from the egg market, right? And we had them, all that in the laboratory, all the laboratory magic, and we got embryos, and they were all pretty darn good. And so we took the best ones, and we implanted 2 of them, and they didn't even make it 6 weeks. And at that point, I was like, all right, something here doesn't compute. We've got healthy eggs from a woman who's successfully conceived healthy children, 3 of them already. And we have like everything going on optimally. We tested the health of the embryos, and yet they're not surviving. So I got some more embryos and I could keep going.
Mhm.
But it's kind of like the definition of insanity, right? Doing the same thing, expecting different results. And at that point, I said, all right, we got to figure out what's going on here. And I went to a functional medicine practitioner, and they were able to help me identify the barrier to me staying pregnant, which in my case was mold exposure to mycotoxins.
Oh,
And so we dealt with that. And, by the time we were done dealing with that, I got to the point where I was like, what, I'm like 50. I don't want to do this anymore. I love kids, but I'm not sure that I want to have a newborn at this point. It's like,
I was
um,
that way at 42 after having my son,
oh,
six,
really?
5 years earlier. Well, because I knew how tired I was with
Yeah,
being 37, popping out my kid. It took us almost 6 years to conceive. So it
yeah,
wasn't a fast track for him. My mom and dad got married in June. The next July, my brother was born. The next August, I was born, and they were done.
yeah.
And my mom was on birth control, which sounds really funny, but she also would be on antibiotics all the time. And those antibiotics negated the
Um,
birth control. So she popped out 2 kids without even wanting to have children at that point. So every body is different. And
yeah,
you're, I think so much of the time, and, this is something that I always bring up with my own situation, the health challenges that I've had, the health challenges that my husband had, prepared me to and gave me the desire to help people with their health. Same kind of thing with you, Carmel. You are one of the most compassionate women that I know. And you have so much dichotomy within you. You're very strong. I'm like, I want to know the answer, but you have all of that compassion that you need to help someone walk with someone through this. So what is the kind of steps that you go through with a new client that has been having challenges, or they might not have had challenges, they just want to be optimizing because, maybe they're like, hey, I don't know how things are going to go. They could be an older mom. What is kind of the steps that you go through to initiate that first, what do we want to look at initially?
yeah. To get the ball rolling, huh?
Yeah, to
Yeah.
get the egg rolling.
To get the egg rolling. Oh, I like that. Ooh, I'm gonna steal that.
That's all
To get
yours.
the to get the egg rolling. Okay. Um, so the first thing I do is that I spend a lot of time with the couple, and not just the woman. As you pointed to before, this is not just about the woman. And it's typically the woman who reaches out and says, "Oh, I need help," right? And then she's like, "This is my story," and she tells me her story. what, and it's almost always that they'll say in some way, shape, or form, like, what am I doing wrong? And so the first thing I do is I like to reframe the whole conversation that maybe you're not doing something wrong, but as I said before, there's just some kind of barrier, okay? There's just something blocking you, and all we have to do is like two detectives or three, right? The three of us just need to bring our heads together and do some detective work and figure out what is that barrier or barriers. It's usually a combination of things, and it's usually a combination of something going on with her, something going on with him. And it's just the way that it all gets put together. It's not working. So first of all, we do a very in-depth, comprehensive history examination for both of them. And then we kind of create this hypothesis, like, well, I think based on all this stuff that it's going to be, these particular things, like let's say, maybe it's we have some environmental exposures we might want to explore. You've had some blood sugar dysregulation issues. Your blood sugar may go up and down, or it's too low all the time, or it's too high all the time. And maybe he's low on his antioxidants, so his sperm can't really perform at the level required. So we have this hypothesis, and they're like, all right, let's test it. And we do some advanced testing. Most people will come with their basic lab work that their physicians have already run.
So like a CBC and maybe a thyroid panel?
Yeah, sometimes they come with the thyroid panel. By the way, I can't believe how many people I see who who I'm the first person to find out that they're dealing with autoimmune issues.
Really?
That's something that's been really surprising for me. Yes. Oftentimes those autoimmune markers, let's say for thyroid, are not run, but a lot of times they are run. I would say about 50-50. And I look at them and I'm like, did anybody tell you that, I see the progression of the antibodies increasing, and I'm like, you're developing this autoimmune condition. Did anybody tell you that? No.
Oh.
So anyway, just a little aside. So then they go off and they do whatever specialty labs to get us a clear picture. I feel like that the more clear the picture is of what the barriers are,
Mhm.
the more targeted and effective we can be. If we're kind of just shooting in the dark, like, well, I think it's this, right? Versus like we have hard data pointing to this, it just allows us to use our resources wisely. I never want to give somebody any kind of therapy or nutraceutical or anything like that they don't need, right?
Yeah.
So,
And I think one of the things that's hard when it comes to labs is really finding out about heavy metal toxicities. And that's something that is near
yeah.
to my heart, because mercury toxicity can cause you to not be pregnant. And I think that might have been one of the reasons why I had difficulty conceiving. And God's sense of humor changed it with surprising us when he did surprise us with our son. But what happened a lot of times for people, actually, I have one client that she wasn't even having periods. And then we did some different aspects of detox and got some things in line. And she's pregnant right now. She has, I think, 10 weeks left. And we weren't focusing on pregnancy at all. She was just exhausted. And she's pregnant and working 2 days a week, where she could hardly get out of bed before. So those kind of things are really important. And mercury, because of how it goes into the reproductive organs and messes those up, causes a male to produce high levels of estrogen, low levels of testosterone. A woman will produce high levels of testosterone, low levels of estrogen. If you don't have that estrogen, you can't hold on to that baby. It's just, it
Yeah.
can't. You have that high testosterone, the body's like, nope, we're not ready for a baby yet. We can't hold on and love it and nourish it the way that it needs to. So we got to kind of let that go. And mercury detox isn't hard, but you don't see it in blood labs. It's more of one of those things like you were talking about with that, here's our hypothesis. If we're looking at it and we go, okay, if we can get rid of this pathogen or this toxin and give your body the nutrients that it needs and the energy that it needs, it's going to get to where it should be in the first place. And
Yes.
that's so doing blood labs, anything else as far as like, I know you do an extensive questionnaire, but do you change people's diets tremendously? Other types of habits that need to be addressed? I mean, if they're coming to you, I doubt they're like heavy smoker, heavy drinker, but you never know because the guy might not be on board. But do you have that happening as well?
I haven't. I haven't
Okay,
yet.
I'm just curious because if the woman's seeking you out and the guy's not necessarily and he gets drug into it, alcohol and smoking is one of those things that will definitely limit the boys from having that full motility and having enough of them to help with
Yes.
that fertilization.
Yes. Yeah, for sure. No, I haven't had anybody thus far that
That's good.
um yeah, so far all the couples they're really on board. And other things that I also do a physical examination, including looking at their neurological system, looking also for structure. Being a chiropractor, of course, I'm looking at the structure and the function of their spine, their pelvis, their cranial bones. All of that has an impact also on it. For example, if there's misalignment of the cranial bones, it can impact a cranial nerve. It can impact the pituitary where hormones are created and released. So, it's it's a comprehensive look. We also look at, yes, their home. What are they using in their home? Any kind of chemicals, um, self-care, right? Cosmetics and creams and those sort of things. We definitely look at sleep. One of the classes that I teach is sleep your way to a healthy baby, and sleep your way to conceiving. If you're not getting good quality sleep, your body, again, it's like you talk about, the body has priorities. So
Yeah, absolutely.
we deal
And
with that. We deal with
well,
foundational stuff like even hydration.
you know what that I love that you brought that up because that's the thing that I bring up all the time. And people are like, oh my gosh, you care so much about water. And I'm like, without adequate water, you cannot hold a pregnancy. You cannot. That is one of the non-negotiables. It's not like you can't have, you can drink soda and stuff like that. You just can't. You have to have enough water in your body because you've got this beautiful swimming pool that baby is in for, all of those months that needs to be water that you're bringing into your body. And when you're bringing water in, it makes all the difference in the way that our bodies function as opposed to juice or tea or anything else that technically has water but is more dehydrating. So what are
Yes.
the biggest things what are the most common, I guess, or most impactful things that you see people doing for that has made a change as far as for pregnancy? So is it diet, lifestyle habits, water? Water obviously is one of those non-negotiables, is what I tell people. It's not negotiable. You have to be drinking the water.
Yes. Yes, absolutely. I think, there are certain things that are just so foundational that are non-negotiable. Water's one of them. And another big one that we really haven't touched upon is mindset or the effect of stress.
Yeah.
Again, when the body is in chronic or acute stress, it's going to prioritize survival and not procreation, right?
Yeah.
So, helping people with daily strategies to deal with their stress, but also to deal with underlying trauma that they've a lot of times not really dealt with before. And when I presented to them as really being critical, not only for getting pregnant, but for the health of their future baby, then there's a lot of buy-in and a lot of interest in suddenly dealing with it, because hey, if this is going to impact my baby's future health, their mental health, yeah, I'm okay, I'm ready to deal with this, whereas before maybe it wasn't a priority.
Yeah. Well, and two, if you've got the stress on top of it where you're a busy person,
Yeah,
you know, people are
right.
probably not coming to see you in their early 20s unless they've had something going on. And so they've
Yeah,
built a lifestyle of stress that they aren't even aware of
right.
that is messing with their adrenals. And then the adrenals and the pituitary and the hypothalamus, with all of that little dance going on, you need to make sure that those hormones are the appropriate ones and the appropriate levels, where like adrenals will overrun thyroid in half a second. It'll overrun all kinds of things because it's taking so much energy and doing such damage over the long haul. I think it's funny. I sent this to you a while back when my husband and I were on a trip, and I was listening to a podcast from Dr. Amy Apigian, and the doctor on there was talking about autoimmune conditions, and I love her podcast. They're actually very good in general. I've seen a couple of them, like, yeah, I'm not so big on that, because they were just kind of basic stuff that I knew. But he talks about certain blood lab tests that you can do for autoimmune conditions, and it just kind of gives you you got an autoimmune that's coming on kind of a thing. But the other thing that he noted was organic food, which was really surprising to me. And they found that when it comes to pregnancy, conceiving, holding pregnancy, having a healthy baby, you having good levels of fruits and vegetables and those kind of things are very important. If you're not eating fruits and vegetables, carbs, like starchy carbs like flours and grains and things like that, aren't absolutely needed. You really don't need to have them at all, because you're going to get enough carbs within the veggies and seasonal fruit. But he was talking about how they did a statistic where the likelihood was much greater for someone to have full-term healthy pregnancy when they did organic, it did more organic than those that didn't. So a crappy diet versus those that have veggies that aren't organic versus those that have veggies and fruit that are organic. The crappy diet and the unorganic were close to the same. Whereas the organic was that much more. So those environmental toxins are a limitation for the body to hold on to pregnancy. And pre-pregnancy, I am big about, if you are wanting to conceive, avoiding sugar when pregnant, obvious junk food kind of stuff, things like that. I just saw that, Sonia. We'll kind of touch on that in a little bit, but before pregnancy, I would love for people to go, I want to have 6 months to prepare to have my baby. 6 months to make sure my body's in check, my husband's body's in check. We're in the right mental state, because you got to be in the right mental state to go through pregnancy. And all of those ducks are in a row so that you've got that chance to get rid of those toxins, and our genetics get turned off and on by stressors. So, making sure that all those stressors are in line, that are kind of taken care of as much as possible, then move into actually trying to conceive. And I think that's where you've got, it sounds weird, but buildup of anticipation. I think a lot of people with this fast and furious with everything, it's, I order it, I want it now, right away. I think that anticipation builds something else into your body and your mind that isn't there when you are, let's try and have a kid now. When, if you can do that, you're going to have a greater likelihood of going full term, and you're going to have a healthier baby and a healthier post-pregnancy, because post-pregnancy can be brutal, especially, like you have things that happen during pregnancy that are unexpected. My sister-in-law, my father-in-law died when she was pregnant. So she had, she had a very stressful situation. She was almost full term and delivered, I want to say, a couple of weeks later. But can you imagine losing your father, who you were very close to? That situation. For me, I ended up having to have a C-section when I didn't want to have any drugs, but it worked out okay because the C-section, I wasn't dilating. He didn't want to come out. And so I at least was healthier when I was at that point. I wish I had known what I know now. I would have prepped myself. I think pregnancy would have gone a lot easier. So when it comes to, we get this great foundation. We've checked things, like what are some barriers that could be going? When do you kind of move on to the genetic testing stuff? Because I don't know anything about that. I've never been a big fan of genetic testing because so much of the genetic testing gets owned by China and they own your DNA. And I'm like, I don't like that. So there are different places now than there used to be. But when do we move on to genetic testing?
Yeah, that's a great question. By the way, that study you were talking about, the organic and non-organic food. So they gave women, and I can't remember how many women, but they gave women organic food. They instructed them to eat it 3 times a week. And just from eating it
That's it.
yeah, 3 times a week, they got 26% more likely to conceive for the people who were eating the organic food versus the no organic food. So, I mean,
Wow. That's
26%.
huge. That's a
Yeah,
big percentage.
it's
So
really huge, and that's only
I love that
three
percentage,
times
but
a
I'm
week.
going to look at it a little bit different. So think about all of those times that you tried
Hmm.
to get pregnant. Let's say we have 4 times that you're trying, and one of those you have a greater likelihood because you just had it 3 times a week, which is nothing.
Yeah,
That's
yeah.
amazing.
Hmm. Yeah, I have that study. It's really incredible.
It's a
So
great one
I
to
mean,
give to people so that they know, yes, this is not me just saying, there's a scientific study that shows this. Let's get to it, baby.
I do. I give all my patients the abstract, say, listen, this is not just me trying to increase sales for their organic markets or whatever. It really matters. And here's the science that shows that. So in any case, around the genetic testing, I think it's perfect that you brought that in because you talk about things coming up in pregnancy, and things do come up during pregnancy. They come up during birth. They come up postpartum. They come up in the child's or early years. They talk about the most important time in a child's development is the first 1,000 days. So, around 3 years, right? And so the genetic test, which by the way, this company does not share their data with China. So, thank goodness.
But that's something you need to check. Honestly, that like, if someone wants to get genetic testing, you need to check who owns that
Yes,
genetic
you do.
information. Because that to
You
me is
really,
like, okay, so you're gonna like create a monster baby with my genes because you want to match something? Like, I don't know. Hey, with the way the technology is going, I don't put past anything at this point.
you never know. No, it's important to do your due diligence. And um, the specific genetic test that I use, I say it's really, really empowering. Some people are a little hesitant to find out what their genes are because they feel like, well, if I have a genetic issue, there's nothing I can do. And this couldn't be further from the truth.
Amen.
Yeah. So the genetic, um, the test that I use looks at 44 genetic variants that are on 27 genes, and they represent 11 key biological processes. All these genes are genes that if you have a variant in it, you get the results and you're like, yay, I got yeah, I'm so glad I know this because now they give you all these actions that you can take to change the expression of that gene so you have a different outcome.
I love
If you,
that. I
isn't that
love
incredible?
that. That's
If you don't know what you
beautiful.
got though, you're just guessing. You're just
Yeah.
guessing. So you find out, let's say, for example, there are, and none of these genes on their, the variants on their own are going to, like, if you have this variant, you're going to have this condition. It's not as,
Not how genetics work.
yeah, it's not how genetics works. And it's when you look at epigenetics, which is the influence of our lifestyle on the genes, that's really the most important part when it comes to genetics, because that's when you get to say what your genes are going to do or not do, right? So, for example, if somebody has a predisposition for, let's say, gestational diabetes, right? We can find out. We're like, great, wonderful. So now what we're going to do is we're going to alter your diet this way. We're going to we're going to supplement your diet with these nutraceuticals to help you more effectively manage your blood sugar so that you don't develop these surprises during pregnancy. And again, so we look at 11 key biological areas. So we're looking at everything from vitamin D to inflammation to methylation, which is really how it's so crucial for so many biological processes.
Well, and even with methylation, that whole
Yeah,
MTFHR, whatever, however I always get it wrong when I say it. But,
MTHFR.
people think that they can't detox, and it's like there's nothing further from the truth. And when you give that good environment internally, that whole terrain theory that Béchamp did, that when you have that good environment internally, the likelihood that that gene is turned on or off, because they have little light switches that go off and on, is going to be much slimmer. And even the response to your body is going to be better because you have that energy, because you don't have all these other things going on that you're dealing with, like, crappy diet or mold exposure or heavy metal. And, for me, heavy metal is, I guess it's just such a big deal for me because I was a painting contractor for 17 years. I didn't know until much later in being a painting contractor, after my kid was already born, that mercury now is used as a antifungal or antibacterial within paint. So you're breathing in mercury, that's this toxic substance, should never have it in your mouth because those silver fillings are silver in color only. They are 50% mercury, 20 something percent silver. So all of these people that think they have silver fillings, that it's actually silver, there's a little silver in there, but you've got 50% are mercury, and mercury is the most toxic thing besides radioactive elements that goes in your body. And they do it willingly, and doctors are still in the United States putting, amalgam fillings in their mouth. So if you have that terrain where
not mine, not my dentist.
Oh, I had somebody recently that got a new filling and it was a silver filling, and I was like, what the hell? Like, honestly, how can a dentist put amalgam fillings in a mouth at this point? I think honestly, I do believe it's criminal at this point. It should be. But, the mercury so as kind of going on to during pregnancy, so we got that conception thing, we've got the genetics, we're figuring that out. During pregnancy, knowing those genetic predispositions are going to be really good, but also the fact that doing that detox before, if you can get that done, you don't have the likelihood of the mercury being transferred from your body into your babies, because that is super important when it comes to brain development, nervous system. My mom has a mouthful of mercury fillings. And when I was a kid, she had a mouthful of mercury fillings. So I know I got a lot of that. I was the most uncoordinated child. I mean, I have pictures of me as a baby, like you'd hold me up and I'd flop down. I'd hold me up and I'd flop down. And I would, trip on a crack in the sidewalk. All of these things that were kind of neurological had to do with the mercury that I got from my mom, more than likely. And it's not like she did it intentionally. None of us hurt our children intentionally. But if you can do that, then you're having a healthier child. Full brain development, full nervous system, the reproductive organs are going to be good, the lymphatics are going to work well. What other things during pregnancy do you think we can do that we haven't really mentioned yet that are more kind of actionable steps during pregnancy?
Oh, during pregnancy.
So we talked about genetics and conception, talked about kind of before genetics and conception, and now how to make a pregnancy be good. Still
Yes,
keeping with those organics, obviously, because you're not putting any more toxins into
through
the
diet.
baby's opportunity.
Here's an interesting one that ties both pregnancy and genetics. So one of the biological areas they look at on the genetic test is what we call neurotrophic factors, which are factors which impact the development of the baby's brain. And one of the things we look at is a compound that's called BDNF, brain-derived neurotrophic factor. Neurotrophic means it grows the nerves, right? It grows the nervous system. And uh, a good time to find out, if you're low in BDNF is when you're preparing for pregnancy. But also, what they found is that during the third trimester, women are just naturally low in this particular compound. And we really need it because the baby's brain is still developing, right?
Well, in our brain, how many pregnant women lose their minds when they're in their third trimester? They can't think. The brain fog is so
Yep.
pronounced because
Yep.
everything is going to that baby to keep that baby alive and healthy. I
Yep.
used I used to paint when I was a painting contractor. I did babies nurseries all the time.
Oh,
Talk
wow.
about a challenging market because they would be like in love with something and then their emotions would be all over the place. But knowing that you've got that, so what do we do to make sure that that neurotrophic factor is being nourished and loved and is helping to for the both the baby's development and the mom so that she doesn't drive everyone nuts?
It's really simple. Activity, exercise.
Oh, that's wonderful.
Exercise
That's
and
free.
activity stimulates the production of BDNF. So, you know,
Wow.
go for a walk, go for a swim. We want gentle exercises that don't involve any kind of rotation, particularly of the body and the pelvis. I had one lady once that came in and her baby was it was diagonal, so it was breech essentially. And she waited until, unfortunately, till like 1 week before she was slated to go get a C-section. And I said, when interviewing her, I asked her, I said, what kind of exercise did you do during? She said, oh, I love kickboxing. And then I'm like, oh no, because in kickboxing, you're like twisting your
Well,
body
that's
and
a kinest.
creating
Yeah.
torsion in your pelvis. So we don't want to do those kind of exercises during pregnancy. We want to make sure that we're not
No hula
creating
hoops.
torsion. Huh?
Hula hoops.
Actually hula hoops are not so bad, and either
Really?
is belly dancing.
That's so fun.
Yep. Um, right. We just don't want anything that forcefully creates torsion in the uterus. And if you're doing a hula hoop, you're just kind of, gently moving the
Yeah.
pelvis. And
So even somebody who's punching, like if you, because
yeah,
we've done MMA, doing a punch, you're twisting your entire body to get
correct.
that energy going. So that would be
Correct.
something that you wouldn't want to do.
No, not really.
Oh,
But there's
I never thought about that, but that's so cool to know that.
Yep, yep. So, I did everything I could to help her structurally, to help create room for that body, for that baby to be able to go into optimal position. But she just had so much torsion in that pelvis, we weren't able to get that to work. Unfortunately, she had a C-section. And so, but there's so many gentle exercises that can be done. And there's no lack of those.
And I'm in love with walking, to be honest. What about rebounding? Can you do rebounding?
Oh, wow. Rebounding when you're pregnant. I'm not, you know what? I'm not sure about that. I have to think about that one.
I don't know if, well, you might not be able to hold your pee because that's one of those things
Yeah.
that extra pressure there. and have to wear a diaper when you're rebounding. But I'm just curious. So Sonia had asked to,
While
maybe
sitting.
rebounding while sitting. You could sit on the thing and bounce probably, but honestly, that the volume of weight that goes
Yeah,
on your bladder.
I know.
The first trimester, last trimester, oh my gosh, I was like,
Difference.
it was like the bladder went to this size when it would normally be like this big.
Mm-hmm.
So avoiding sauna, hot tubs, things like that during pregnancy is really important. Um,
It
Anything
is.
else during pregnancy we need to avoid?
No detox.
Absolutely. Yes, that's great
No
to bring up.
detox of any kind.
And you
Um,
might, even during pregnancy, you might become aware that you might have a toxic element that you are, something that you're dealing with. And it can be a variety of things, especially during pregnancy. I was super healthy and strong during pregnancy. My body just was like ready to go. God was like protecting me during that time because I didn't get a cold, didn't get sick. I was nauseous because I wasn't drinking enough water at one point. But that was one of the hard parts. But if you become aware of some sort of toxicity, never, never, never during pregnancy or breastfeeding are you ever going to do a detox. And honestly, I think you should, with pregnancy, pre-pregnancy, work on detox with a practitioner. Trying to do it on your own, it is a much more difficult dynamic. And at least with us being trained the way that we've been trained, we know what those signs are that we need to adjust and do things differently. Whereas if you're doing it on your own, it's a lot of guessing, and that can cause that detox time frame to be much longer. And post-pregnancy, if you are breastfeeding, you need to think there are toxins that can go into the milk of that baby. And you want to make sure that that baby is getting the cleanest, healthiest, happiest breast milk that can be, done. And breast milk is amazing in and of itself. But the fact that we need to still keep with that, non-detox kind of thing is an important thing to keep in mind.
yeah, absolutely. That's like cardinal rule of
Yeah.
pregnancy.
Yeah. Anything post-pregnancy that you think about?
Yeah,
Like post breastfeeding and everything. Like, what about second children, things like that? Because I know sometimes when people have not been able to conceive, they conceive and they have a kid and they're like, I want to make sure I get another one so that they're close together. What's that kind of dynamic for you?
I haven't dealt a lot with working people in that scenario. Some of my patients have older kids that are not breastfeeding, but I just haven't encountered that specifically. But what I will say about the postpartum time is that one of the most common things we deal with in the postpartum period is that women are in a big rush to get back to their original size and shape, right? And what I will commonly see is that women are actually very malnourished during this time. And so making sure that they're eating enough and they're eating enough quality food to nourish them and to nourish not only their needs, but if they're breastfeeding, their baby's needs, and to look out for postpartum depression. Now,
Amen. Amen.
after
I
I
think
tell
I
you
think
what,
we don't recognize it nearly quick enough with most women.
no. And I reached out to the company that does the genetic tests and I said, listen, if we can predict all these other risk factors for getting pregnant and for pregnancy and birth and the baby's health, what about postpartum depression? So they did say there are some of the there is research connecting some of these variants with the onset of postpartum depression. And so that is one tool we can use to, if we get some of these variants come up, say, okay, this person genetically is more susceptible to having postpartum depression. So let's create a plan ahead of time. And I do collaborate with local therapists who work with couples also to prepare them, particularly first-time parents. How's this going to shift their life? How are they going to do things differently and support them in that new phase of their life,
Yeah.
such that they are prepared if those symptoms pop up. They have resources, they're looking out for it. And a big part of that, I think, is really around nutrition. It really is, Kari.
Yeah. And it's all those foundational things that, they talk about the seven doctors: water,
Mhm.
food, sunshine, activity,
Yes.
grounding, and what's an emotional, like, you've got six doctors, seven doctors, five doctors, people will call it all different kinds of things. But God had these design limitations for our bodies, and they're like in Psalm 139 it says, you hedge me behind and before. He's keeping us where we're supposed to be. And we are wonderfully made, and marvelous are his works. So we've got that design. We just have to fit within that design and how we do things, and honor that, because I think that's where we see the best success when it comes to getting pregnant, holding a pregnancy, post-pregnancy. And even if something happens like for you, I know not being able to conceive, it still weighs heavy on your heart because that was such a passion for you. But I love that you have turned that and given opportunity for others to have that benefit of having a child that possibly wouldn't have if you hadn't gone through all of this stuff. You went
Yep.
through a lot of different things. I was painting when we were trying to get pregnant. I was painting contractor then. And one of the medications that they gave me was to help me ovulate better because they thought I might not be ovulating well. And I was taking it religiously. I was like being so faithful because I really wanted to have a kid. And what ended up happening is I was on a ladder and I got dizzy. And I'm not talking just on a ladder and got dizzy. I was in a house on the edge of a mountain that had stairway and stairway and stairway on a ladder. And I'm at the top of this ladder and I'm like, Lord, help me to get down. And I had the hardest time navigating getting down the ladder. I climbed up and down ladders like a monkey, just getting down the ladder and moving down the steps and taking my ladder and putting it in my truck. And I'm like, Lord, if I can't drive home, don't let my car start. And it started. So I'm like I was having vertigo. It was all over the place. And called the doctor and he's like, you shouldn't be taking it. That's telling me that your hormones are okay because you're having this reaction. But there's so many things that we tried to, conceive. And then I had a yeast infection. My husband had a rash over his whole body because he had gotten into a plan at work that his body was unhappy with. We had sex once that entire month, and that's when we conceived. So
Wow.
it's not all of the other things necessarily. We kind of have to give that up to God and let him take care of it in his timing. But
Mhm.
I think there's so much that we can do to prepare and get things ready. I love that my one client that wasn't even trying to get pregnant got to a point where she had regular periods and she said, do you think I can go ahead and try? And I said, you know what? I'm okay, but I just make sure your energy level's okay, consistent for a couple of months, and then try when you want. And they have a baby that's coming soon, and I am praying for them daily that it continues to go forward. But I want to open this up to so if you want to ask a question, you can throw something in the chat. Sonia, you had some good questions. You have other ones that you want to do? I'm gonna say, let me see if I can do this. I don't know what is happening. You can unmute yourself if you want to ask a question. No questions? Snide remarks? Comments? You can unmute yourself. It's all cool. I said that you could unmute yourself now, so if you do, so you can unmute. If you want to unmute too, Jess, you can unmute. I appreciate y'all being here. Thank you, thank you. I don't know
Yeah,
what I
thank
would
you.
do without you today. We had some challenges.
That's great.
Great question. Great
Usually
question,
say
Sonia.
that.
So what Sonia wrote in the chat is how to detox from the pill before trying to get pregnant, which is a wonderful question. I'm sorry I hadn't thought about that earlier. Good one.
hmm Yeah, I would say one of the most important things is to know it depends how long somebody's been on the pill. So I know some experts will say that for every year you've been on the pill, you need a month to of being off of it, and taking specific nutraceuticals to help balance your hormones and improve your uterine health, right? And so if somebody's been on it for 10 years, that you would expect to spend about 10 months. And part of that is also supporting your liver to be able to detox all the estrogens. Now, not everybody releases or processes or detoxes in the same way. That's also a genetic thing. But like everything else, we can also, with what we do in our lifestyle, we can impact the effectiveness of your ability to detox. So everybody's just a little different depending on, and this is why by the way, this is why I like to do the genetics early on, because it gives me a sense like, if somebody's been taking birth control for 10 years, well, great. Somebody who has really great detoxification pathways, it might be less than 10 months. Somebody who has really poor detoxification abilities, it may take us a year and a half. So I think it's really important to know what we're dealing with to also give people, a fair estimate of what it's going to take to, to do the job. I think that,
Absolutely. Yes.
I think that
Unique.
you probably have
Everybody is
really
so
good,
unique and so beautiful in their
yeah,
creation that sometimes you're going to have somebody that gets off the pill and is like moving forward real fast. Obviously, like with my mom, she was a little fertile myrtle. She wasn't even trying to get pregnant, and just being on antibiotics got her pregnant. Well, and having sex. It's so funny. My husband and I used to say we tried for almost 6 years, and then we had sex, and it worked. So, it's like,
you're too funny.
So it's some things are within your control, some things are not. I think a lot of times that passion is put in you because of what your gifts and skills are. And I know that you have such a passion for helping people. And it's funny, I am having my friends on webinars recently. I'm talking about different subjects because I have a plethora of resources with these beautiful people that have the same passion that I do to help people get healthier, to do it in a way that is tangible, easy for them to be able to understand and be able to create the life that they want. Sometimes people just want to be healthier. Other times they really want to have that child. And knowing that I've got Carmel by my side, if there's any questions that I ever have, then that to me is, I have a lot of resources, people, a lot of resources. So I'm going to put in the link here. And Carmel, if you want to, in the link, put your contact information as far as social media, things like that. So if you want to start working with me and discover what your limitations might be to being healthier, I don't specifically target pregnancy, but I do target overall health. And so if you want to work with me, there's a link to sign up for the strategy call. Right now I'm doing a special. Instead of $497 for the hour-long call, this super comprehensive analysis of a questionnaire that you have. And it's a long questionnaire. It took me 45 minutes to put it together and to answer it. And I know the questions. So it's a very comprehensive examination of it. We figure out what blood labs we're going to need to do, things like that. So if you put I am special, if you click on that link, you will get it right now for $97. And with that link, with that $97, when you sign up for one of the programs, we can apply that 97 to the program too. So you're saving an extra deal on that. On social media, I am at Dr. Kari Barron or hashtag Dr. Kari Barron, KariBarron. And Carmel, did you want to put your information in there for everybody too in the chat?
Yes, I will. I'm typing it in now.
Okay.
Oh, I know. I'm let me grab it from the email I emailed you. Keep talking.
Okay.
Oh, here, hold on.
So Carmel and I both do, we want to get to know you all before we dive into doing a huge program because we want to make sure there's a good fit. And so working with people, Sonia, I appreciate you being on the call. Jess, thank you for trying to help me earlier with everything. You are a blessing to my life. And you know, Carmel does a lot of webinars. Are you on social media with, do you have a YouTube, Dr. Carmel too, or?
I do. I have I'm on Facebook. I'm just Dr. Carmel. I think on Instagram I'm Dr. Carmel. It was
Dr. Carmel, yeah.
Dr. Carmel. I'm on YouTube. Also, Dr. Carmel. I'm just everywhere, Dr. Carmel.
That's like me.
LinkedIn.
I'm Dr. Kari Barron everywhere. So
Yeah.
DrKaribarron. That's nice
Yes.
because Carmel is easy to spell and so is doctor.
Yes. Well, yes, I guess so.
Cool. Anything else that you want to add? I appreciate you going through the different steps of trying to get pregnant, you know, what we can do preconception while you're pregnant and postpartum to have the best experience. You bring us so much information. I'm like, I wish I could, you know, dive into that more if I were pregnant. I don't have that situation, and I have a 22-year-old, so no babies right now, boy. But I'm excited to see what people get to experience from learning this a little bit that we've had time together.
I will add that tomorrow I'm doing the first of 3 webinars. I've just put that in the registration link in there. So if you want to find out more and about the hidden causes of unexplained infertility and how to overcome them, I'll be doing that webinar tomorrow, and then I think the 19th and the 27th. So that's the link to register, and if you just want to dive in deeper. So
I love that. Thank you. And I will, my computer is not the happy thing right now for me, so I'll have to get that link from you so that I can share that in the YouTube description. Hopefully, if you can join us. Thanks so much.
sounds good. Thank
I'm going
you,
to turn the
Dr.
recording
Kari.
off. Thank you.